Now, live with Governor Asa Hutchinson.
And welcome back to our virtual town hall with Governor Asa Hutchinson. We are talking about the impact COVID-19 is having on the state and our regional area.
Yeah, and the country for that matter. The U.S. unemployment rate in April could hit 15%, a number last seen at the tail end of the Depression. Arkansas's delegation at the nation's capital working to help Arkansans survive this crisis.
Washington correspondent Jesse Tenura spoke with some of them and is passing their questions to the governor. Hi, Jesse.
Hey guys, this feels like a reunion of sorts right now. Thanks for having me.
Go ahead, Jesse. Pass along your questions.
What we wanted to hear first, I thought that I would start with Senator John Boozman. So Governor Asa Hutchinson, he's wanting to know our agriculture community, trucking industry, and grocers are doing incredible work to ensure that food and critical supplies remain in stock. Much like our medical professionals and first responders, they are critical components of us getting through the crisis. So what steps are being taken at the state level to protect the supply chain from disruptions that could arise if coronavirus does spread to those who work in our agriculture industry?
Well, Senator Boozman, that's a great question. First, let me say our federal delegation has been so helpful to us, everything from getting the disaster declaration to breaking the log jam and some of the supply chain issues for our protective equipment that we need. So I just applaud the partnership that they've been. And Senator Boozman raised a great question about our agricultural community. We forget about how essential that food supply is. But, you know, in terms of, I'm grateful that in the agriculture community so far we have not had a serious outbreak that I think impacts the workforce. But we've had a delay because we haven't been able to get in some of our visa workers that traditionally every year work in the agricultural community. So they are shorthanded just because of that impact from the coronavirus. And so that's another reason that we've got to get back to business. But also maybe there's an opportunity there. Whenever people are unemployed, they're looking for jobs, don't forget about options in the workforce, in the agricultural community, because they still need to be able to produce and keep that agricultural supply chain going.
Jesse has another question from Bruce Westerman. So Bruce Westerman is asking the question. He's really talking about municipal-owned hospitals. They aren't eligible for SBA loans and PPP under the CARES Act, but the bill does include a $1.2 billion grant to the state and other funds such as community development block grant money through HUD. So his question is, in what ways can we continue supporting these rural hospitals and making sure that they are not overlooked for funding?
Well, the Congressman is absolutely correct in that being a very genuine concern. Our rural hospitals are struggling because we have prohibited or discouraged elective surgeries, and that's a revenue stream for our rural hospitals, and they don't have the level of COVID patients, thank goodness, and so many of them are really in financial strain and are not producing the revenue that they expect. In terms of the municipal hospitals, there will be an opportunity for them to make the case that they're financially constrained to utilize some of the federal money that's coming for the state for COVID-related expenses and costs that we incur. And so we expect to be able to help our hospitals, and I don't believe there will be any problem in helping the municipal hospitals that you're speaking of.
Okay.
We've got another one. This one coming from Congressman Steve Womack, and Dr. Smith, I think this one's headed in your direction. He's talking about the restrictions to address coronavirus in communities. Can you talk about the targeted restrictions and mitigation tactics that have helped Arkansas stop the spread? How has the scientific modeling played into the decision-making process? Either one of you can answer this one.
Well, we're looking very carefully at the way that COVID-19 is spreading elsewhere in the world, and what can we do here to prevent the spread in Arkansas. The modeling has been helpful to some extent, but we're learning so much about this as we go along that we're having to learn those lessons and implement them in a very, very rapid-fire fashion. We know how it spread, but actually knowing which interventions are most effective it remains to be seen in some cases. I think in Arkansas, the governor has led us with a targeted approach and taking it seriously, all the steps that he's put in place. And I think that's worked very well. Again, what is important is what we do, not just what we say we're going to do.
Okay. And also, we got a question from Senator Cotton. His question is, what can Arkansas do to untangle critical sectors of its economy from China's? And how can the state of Arkansas help hold the Chinese Communist Party accountable for their actions that let loose all of this onto the world?
Well, Senator Cotton raises a very good point about our supply chain. I think we've all realized that while we expect to go into Walmart and we see a lot of goods that's produced across the globe, whenever it comes to our medical equipment supply, you don't expect us to be totally dependent upon our foreign companies or our American companies that produce overseas. And now we're having to negotiate with our supply chain in China. We're trying to get those goods back, whether it's N95 masks, because 3M produces those in China. It's been a huge challenge for us. So the question is, what do we do about the future? And to me, the answer is we've got to bring those industries, that manufacturing, back to the United States of America. That's what we've been focused on as a state. We've been successful in bringing a lot of the manufacturing back, but we haven't been able to concentrate on the medical supply chain, and I think that's the future. I do hope the administration, and I think they will, engage themselves, and maybe even the Defense Production Act that the President can utilize to direct some of our U.S. manufacturers into that medical supply chain. And I think if the President and the administration will help get us started that way, then the private sector and the free market system will take over, because the demand is there, and we never want to be caught short again like we were in this cycle.
Well, we know that we're moving into another political cycle. If we're not already in it, a lot of folks may have forgotten the fact that come November, we've got a little something we have to do.
Oh, yeah, we have to vote.
We've got an election coming up. Jeff in Little Rock wants to know, Governor, are we looking at mail-in voting? Is this even something that is on your radar at this point?
Well, certainly the November election is on our radar, and we just had some special elections, and I, through my emergency powers, removed the requirement for a reason to vote absentee. So we made it no excuse absentee voting. And that way everybody could vote early. It spreads it out. There's not the same public health risk. And so we look at November. We don't know what position we're going to be in. And I hope this is all behind us and that we can have a regular election that everyone has no fears. But in the event there is that continued emergency, I assure you that I would want to make sure that we can have no excuse absentee voting for everyone in that election in November. The mail-in ballot is a different issue that's more complicated, and I don't see us being able to get to there, in the November election.
Well, hopefully we won't have to deal with that, and it will be all behind us. That's what we're keeping our fingers crossed for. One of our viewers left this question on our voicemail. Take a listen.
Yes, my name is Daryl Atkins. My age is 63, and I wanted to ask the governor if the mosquito is able to carry and transmit the coronavirus.
I know he's saying governor, but this might be a question for
It
Dr.
is.
Smith.
I'd love to answer that, but I think he's more authoritative.
Right.
No, we have no evidence that coronavirus, any coronavirus and COVID-19 in specific can be carried by a mosquito or tick or any other type of insect or vector, what we call. This seems to be really spread from one person to another and also from surfaces.
So
you just gave a lot of people in the Delta, the agricultural community, a lot of confidence right there.
That I would say a lot of people are probably leaning towards widespread mosquito eradication. It's not going to be happening. It's got to deal with it. Get the spray.
That's exactly right. Well, Jackie in Little Rock, she wants to know if the virus is seasonal and returns before a vaccine is found, will there be another shutdown if that should happen?
If Dr. Smith could comment on what he thinks the odds are of that, then I would have a follow-up comment.
Okay.
Well, it's really difficult to make those sorts of predictions because we have so many unknowns here. Our hope is that come summer that the activity of COVID-19 in the United States would go down and that we would hopefully have a vaccine fairly soon. But if we see activity, if we see new infections, we're going to have to take appropriate actions to limit the spread, whether they're the same things that we're doing now or whether there are some subset of those remains to be seen.
And I would just add that once the current emergency subsides, then I want to look at the potential for a reemergence next year and be very well prepared for that. And so we're going to stockpile our N95 mask. We're going to make sure we have adequate supply, and we're also going to make sure that we can be prepared for education in every form so that we can go ahead and protect against what is the potential for a reemergence of this.
This has certainly taught us to be ready.
Yeah, absolutely.
That's for sure.
Well, who would have thought that just a few months ago we thought we'd be in the middle of the sporting season would be kicking off. Events canceled all over the place. Drew Ammon from our Pig Trail Nation has this question.
A lot of Hog fans are ready for football season and excited to see Coach Sam Pittman in action. We also know it's possible we could see a second wave of COVID-19 this fall. How much of a say does the state of Arkansas have in whether the SEC should allow fans to attend games? How would lost ticket sale revenue trickle down to affect other schools in the University of Arkansas system statewide?
Wow, you expect me to answer that question? But, you know, I actually mentioned in my State of the State address that this is going to cause us to rethink a lot of things as to what adjustments do we need to make socially in our engagements with one another, but also the question is going to be how will this impact sports, as you raised, and I hope that we can go back to enjoying the Razorbacks in every aspect, and I believe that we will. I do think that there's going to be some considerations as to how we can better prepare our stadiums for these health risks that people might have. And I think that we can do those things. It's going to take some adjustments, but if you don't make those adjustments, then you can play games without fans, and nobody wants to do that. So I think that there's going to be a lot of thinking that goes into that. Happy to partner with you because I want to make sure the Razorbacks are playing next year, and as well as all the other sports teams in the state.
I think people are going to be wearing masks for a long time to come now. I really do.
Certainly be washing their hands.
That is for sure, and using hand sanitizer.
Well, I'll take it back. I think about War Memorial Stadium. The War Memorial Stadium, the seats are very compact. And I think it's going to cause us to look at, do we need to reconfigure the stadium to give more social distance, probably not 6 feet, but where there's a greater comfort level. It might reduce the audience size, but you will have audience and they've got to feel comfortable in that environment.
Something to think about, that's for sure.
10% of something is better than 100% of nothing.
There you go. A lot of things will be changing, and we want to thank you for that. As we go into the break, we want to share a few more pictures of families living through social distancing and trying to find some good times in this pandemic.